Hip Arthritis by Bailey and Jayme.
So what is osteoarthritis? Osteoarthritis is a degenerative joint disease which breaks down cartilage, causing pain, swelling, and problems mobilizing the joint that is affected. It can worsen over time and cause the bones to break down, creating spurs. And in the final stages of OA, the cartilage wears away and the bones can rub together, leading to more pain and further joint damage.
Types of OA are idiopathic, which is in primary, which is local, which is 1 or 2 joints affected, or general, which is 3 or more joints that are affected. Another one is secondary, which is there's a known cause for the osteoarthritis, so there's either a joint injury or there's an underlying pathology.
So common joints that are affected by OA are the knees, hips, the lower back, and the neck. The fingers, thumbs, and big toe can also be affected as well.
Who does it affect and the risk factors? So commonly found in individuals that are over the age of 65. So age does play a factor. The older you get, the more likely you are to have OA. Obesity plays a huge factor because of the weight on the joint, so it's an overuse injury, which is another cause, is previous joint injury or an overuse of the joint. Weakened muscles around the area which isn't holding the joint properly together, and genetics can also play a factor in that. The diagnosis of OA, so they're based on the symptoms that you're having that your physician will see. So for your physician, what he's going to be looking for is joint tenderness, crepitus in the joint itself when you move it, bony swelling, excess fluid in the joint capsule, reduced movement, so reduced ranges of motion for you, or they're painful, joint instability, and muscle thinning. So some of the symptoms that your doctor will specifically be looking for, or that you may be experiencing yourself, will be joint pain, like we had said earlier, a loss of flexibility, so a decrease in your range of motion, stiffness in the morning, but it progressively gets better throughout the day, so less stiff throughout the day. Or if you sit for longer periods of time, or periods of time where you're immobile, you'll have a harder time getting up and getting moving. And development of bone spurs is another one. So the test that you'll do, or that your doctor will prescribe you to go get done, generally a blood test is done. There's no actual blood test that is specifically for OA, but what it is used for is to see if you have any other underlying conditions or any other different types of osteoarthritis, like RA. An X-ray will be also performed. That helps you determine the most common way to determine OA. And basically what it's going to be looking for is bone spurs and see if there's any calcium that's settled in the joint capsule itself. The last one that is rarely used is an MRI. Basically that's just going to determine what the X-ray can't pick up off of a standard one. It also just shows you how the soft tissue is dealing with it around the capsule itself.
So some treatment options for OA. So there's only treatment options to reduce the pain and the symptoms, but there is no cure for OA. So everything that is listed is to prevent further injury, and it helps reduce the pain and the symptoms. So there's different medications that you can take, such as topical analgesic ointments, NSAIDs, cortisol injectors, and hyaluronic acid. So topical treatments are useful for those with OA in smaller joints, such as in the elbow or in the fingers. It works a little bit better than joints such as the hip, which is a little bit deeper. Zoystrix is a common cream made from chili peppers that, however, reduces mild pain that people with OA may be feeling, but can cause a burning sensation as a side effect. Voltaren gel is another treatment that people will use. It does relieve some of the pain as well, and some of the joint pain. So like I mentioned before, injections people often get. They're effective for a short-term remedy for people with moderate to severe pain, and people usually particularly get the injections during flare-up. Not more than 3 to 4 shots a year, as they can cause further damage to the joint. Hyaluronic acid is a joint lubricant injected into the joint, and usually provides relief, but sometimes doesn't reduce the pain. So some therapies that can be offered for OA are massage therapy, physiotherapy, and acupuncture. So in massage therapists, we can reduce the symptoms and the pain. Obviously, we can't really cure OA, but we can definitely help our clients with their pain management. So we can use techniques such as static contact, stroking, and effleurage to help reduce and decrease their pain. We can also do range of motion with the affected joint to keep that joint mobile and to make sure that their range of motion doesn't decrease and that it stays at where it is. The longer you have OA, sometimes the worse that it can get. So if we keep their joints moving, hopefully they'll maintain that and have good range of motion. As massage therapists, we can also help our clients with stretches and strengthening exercises. We can help strengthen and stretch other compensating muscles that your client maybe feel that is tight. We can also do strengthening on the muscles that are weak due to the OA. Also, as massage therapists, we can recommend home care, which is really important. If they continue to do the exercises such as range of motion, it'll honestly benefit them in the long run. We can also recommend hydrotherapy, such as heat and cold, which will help relax the muscles and soothe the stiffness that they may be feeling. People do tend to go to physiotherapy as well. Once again, we can work with physiotherapists just in maintaining the range of motion, and they may have some other exercises that work for OA better than what we have. And also another big one that we've also mentioned is exercise. Exercise plays a really big role in OA because if you don't keep the joints moving, it's just going to get worse, and then it's going to definitely cause more pain, and it'll definitely decrease their range of motion. So there's exercises such as stationary bikes, which are really, really helpful, especially in hip and knee osteoarthritis. This way they can sit down and they're not putting any more pressure on their joints, but they're still moving the joints around. Aquatics, walking, and other physical activity as well. So aerobic exercises are really important because they keep the joints flexible and lubricated, and then they can do strengthening exercises that help build up the supporting muscles around the joint. Even if you just recommend your client to do some walking, like 10 minutes of walking a day, it actually really improves their joint mobility.
So a big one is for aquatics. A lot of clients that are suffering from OA or RA do enjoy aquatics because it helps provide exercise and resistance in the water, and without the pain of the gravity that they would be experiencing, it also gives them the exercise without having to worry about the weather outside and such. So these are our references that we've used to talk about everything that we've talked about previously. Thank